Okay. I know that my screen and voice is clear. If it is not, you may put a message in the chat box if anything is not clear. And I will periodically go there and have a look. Morning, everybody. Well, this primarily is being conducted on at the behest of the management, primarily to look after the health of our beloved students. To whom do we deserve the best interest of health? To the parents of all those who are studying in our institutions. Now, as you know, we are in the midst of a terrible pandemic. Nevertheless, health is wealth, and it is up to us to look after it. Basic fundamental precautions are all that is required to gain good health, in the absence of which life hangs by a thread, and by chance you get into the grip of a corporate hospital, they're waiting to simply rip us apart. Unfortunately, that's the scenario. Medicine is more today a business. It is sad that it is unfolding in that pattern, but even for that, there is a reason. Well, come back again. Let us look at what basic fundamental tenets are to be observed in order to maintain good health. Now, this talk has been given to a variety of platforms, and all those who have come have expressed their extreme acceptance and well taken, and the potential that it can save lives. So, therefore, let us basically go into the fundamentals of health. 10 means 10. We started sharp 10. But nevertheless, I have waited for another 3-4 minutes more, expecting parents to come in large numbers. Now, if this is not received, and if hundreds of parents, how many students are studying in AJ, both medical and dental, and if people are reluctant to find better things to do, then I will stop these programs. So let me make that very clear as well. So now concerning health, I have in detail looked at a variety of factors that govern good health. And let's have a look. My titles, once upon a time, professor and head of head and neck surgery, head of medical education, associate dean of the college. But then I've given up all that. Today I'm just a professor. In a way, it is good to relinquish titles and focus on academics. Now let's have a look at your teeth. For a child, introduce low fluoride toothpaste. When should you introduce it? When the child is just 2 years of age. Use a child-sized toothbrush with soft bristles and use a low fluoride toothpaste for children under the age of 7 years of age, because as we know, a higher concentration can of course cause fluoride toxicity. It doesn't really matter. It's of one standard concentration here in India, but specifically abroad, you have low fluoride toothpaste primarily meant for children. How much should you use? I find parents fill the entire length of the toothbrush. No, it is just a small pea-sized amount of low fluoride toothpaste across the toothbrush. And encourage children, sometimes because of this minty flavor, sometimes they may swallow it. So encourage them to spit out the toothpaste. And when they brush their teeth, supervise until you are sure that you can do it well. And periodically have a dental checkup. When should you check up? Within the first 6 months of eruption of the first tooth, no later than 12 months of age, because at that time several requirements are there. Now, what will the dentist do at the first checkup and oral inspection for any abnormalities, breast and bottle feeding habits? Now, in this regard, I must tell parents, never ever breastfeed a child while it is lying down, because the ear canal to the ear, called the eustachian, is broad and wide. And the moment they are breastfed lying down, this milk will regurgitate via the eustachian tube into the ear and cause terrible ear infection. How many young, small children I have seen with very bad ear infection because the mothers were not taught that children should only be breastfed while upright. Sometimes if the mother is too exhausted, then while lying down, they will breastfeed. This milk directly will go into the ears and cause infections. So however tired the mother is, one should only prop up the baby upright and then only feed. So again, the dentist will look at tooth eruption, and where the drinking water is not fluoridated, he will look into what fluoride supplements are to be given, and home care, including tooth brushing and the use of fluoride. They will also look at thumb sucking. Well, quite common, but one psychologist said, you know, children who thumb suck are craving for affection, and they do not get the requisite affection from a parent because they are too busy, they're working and all that. They start getting the affection from thumb sucking. So that's another pointer. Now, what do you mean by a fluoride varnish? Fluoride varnish is a thin coating of resin that is applied to tooth surfaces in order to prevent or arrest decay. We never knew about these things, that there is something called a fluoride varnish. Now, it has been proven effective in infants and children. And if you have small children, I know that you're all past that age, but if you have small children, breastfeed on demand at night, chronically use high sugar medications, then a fluoride varnish will definitely be effective in preventing caries from later developing. Now, when should a person apply a fluoride varnish? This is the initial application at the first visit itself is followed by a second application of fluoride varnish between 3 and 6 months. So there is something called sealants. Now, unless I highlight these things, you will never know about these things. Sealants, what are they? They are thin clear shaded plastic coatings applied to the chewing surfaces of the first and second permanent molar, and that is to prevent caries. These are applied by pediatric dentists as a subspecialty called pediatric dentist, periodontics, and they apply these seal out food and bacteria containing plaque that tends to accumulate in the crevices of the chewing surfaces of the back teeth and cause cavities. How many children we have seen with the cavities at the back part of the back teeth? So therefore, to prevent all that, these thin, clear, shaded plastic coatings are applied to the occlusal surface of, of the first and second permanent molars. That's about sealants. Now, how long does it take? It takes only one visit. So at the very beginning itself, your pediatrician should guide you about these things. It takes just one visit to a good pediatric dental doctor, a periodontist, to apply sealants, and are only one step in preventing caries. Because once that happens, it becomes a lifetime problem. It is rather better to avoid it. Brushing, flossing, limited snacking, and regular visits to the dentist are all essential for good oral health. Why am I spending so much time on oral dental health? Because these teeth are to last you a lifetime. So a little bit about these crevices, which are there, the narrow groove, which these are applied the sealant. Dental sealants protects children's second teeth from decay. And these sealants are painted on new molars to stop food. Quite often, if you look at your own teeth, there will be food collecting in the crevices, and that can be prevented by applying a sealant. Now, not all children require sealants, but ask whether your child requires it when you visit your dentist or the dental therapist. Now, quite often we just brush teeth. Nobody ever we study so much about PUC and BSc and all that. Is there anywhere a class is taken on how to brush your teeth? Oh, he is educated and he should know all this rubbish. The current education system, fundamental aspects of health are not covered in any schooling format. So I hope hygiene, personal hygiene should be the first thing taught. And when I ask patients and parents, and so many, they have no clue. Now, the cleaning of the teeth and the removal of plaque is done by brushing properly. Where should you brush? Along the gum line. We often brush on the teeth like that. Actually, it should be along the gum line. Why? If you do not do that, plaque can accumulate. I've seen very bad, terrible plaques accumulate, and eventually the teeth will fall off. And who has taught the proper way? My intention is to start a separate, not under the separate university with no exams. The self-directed learning process, everything is online. And finally, the student will come out with extraordinary knowledge and fantastic skills. Do we teach swimming? Do we teach basics of car mechanics? Do we teach about self-defense in an education? By the time a student comes out, he's pretty much incompetent in just about everything as a graduate. It's so sad that the education pattern is like that. But again, come back again, do not use a tongue cleaner, just the toothbrush, and gently just scrub on to clear off the accumulated debris on the tongue. Again, I repeat, where should the brushing be? At the gum line? And do we ever brush in this fashion where the inner aspect of the front teeth called the incisor and the inner aspect of the lower teeth? How often when I look inside, there's terrible plaque accumulated there, and so sad that we have no clue. Now, in between, if there are food debris, there is a thin piece of string available, and you're expected to sort of push it in between and pull it in and out to clear off the debris here to make it nice and perfect and free. And this thing is called flossing. Do we ever even talk about flossing in a school setting? We talk about history, we talk about moral science, we talk about Sanskrit, we talk about Hindi, and as a consequence of which we will have no idea about anything. So that's about flossing. Now, a little bit about flossing. People with periodontal disease are twice as likely to suffer a fatal heart attack. Did we know that? So, oh my God, they had a heart attack, but did you ever take care of your dental at least once a year? Have you gone and got your teeth cleaned? We had hardly ever done it. So they were thrice as likely to suffer a stroke. So where does it start from? From the teeth. From periodontal disease, once a year, go to a good dentist, and so many branches of dentistry, but at least once a year, go to a good dentist and get your teeth thoroughly cleaned. Now, new studies show that diabetic patients with severe periodontitis, they have difficulty in maintaining normal blood sugar. So that is where it all starts. And infected oral tissue with pneumonia bacteria can be inhaled into the lung, where immune defenses fail to wipe them out, and eventually they can have pneumonia and death. So that's of paramount importance to take care of good dental hygiene. It's also known that mothers of premature born babies are 7 times more likely to have advanced periodontal disease than mothers whose babies were normal at birth. You see, therefore, do we have the dental hygiene for expectant mothers? No, we absolutely do not have that. So it is so sad that the healthcare system in this country is in such a pathetic state. Now, individuals with artificial joints and heart valves are at an increased risk of suffering a serious injury. How many people nowadays, because of arthritis, it is so sad that many of these degenerated joints can be brought back to normalcy by normal medications. You don't have to undergo a joint replacement, but unfortunately, that is a trend. And now, once they undergo a joint replacement, they are at an increased risk of suffering serious infection when periodontal bacteria enter the bloodstream. So therefore, take good care and make sure you have good dental hygiene. Now, it is a belief that the more toothpaste you use, the better is the cleaning result. No, that is absolutely wrong. The cleaning of the teeth and the removal of plaque is mainly done by brushing, not cover the entire brush with toothpaste, as I have often seen, and brush at the gum line above and below, brush at the gum line outside and inside along the gum line. Has anybody ever taught you these things? You have not been taught. So you see, that is the very nicely maintained teeth. And now, too much toothpaste can actually cause the brush to slip, and the cleaning can be less effective. Now, how much of toothpaste should you apply? Apply that much that will just cover half of the brush head, and that is good enough. You see, half of the brush head. Well, when I start my own university, all that will be incorporated so that you come out as a sterling, fantastic graduate. So anyhow, come back again. Few fundamentals: use a soft bristle brush, replace it every 3 months. Quite often, when you look at the entire bristle would have got eroded and almost it would be a bald head. While brushing teeth along the gum line, angle it at 45 degrees so that it is up against the teeth and gums, and jiggle the toothbrush back and forth in small round strokes. The correct motion is more like a massage along the gum line than actually brushing. And for all of you, just brush it all along the teeth. The gum line is largely neglected. See the way the brush is held at 45 angle along the gum line, above, below, inside, outside. That's how you should be brushing your teeth. If you do not do that, this calculus can start accumulating. And quite often when I observe, it will all be filling the inner aspect. Why the saliva is concentrated here, you will not find that much elsewhere. But this inner lower teeth, where a large amount of calculus may be there, there will be gingivitis, and you would have neglected all that. So at least once a year, go to a good dentist and get your teeth thoroughly cleaned. You see, that's how it should be. Now we leave the teeth there. People often, the Johnson company is quite rich. You don't have to keep feeding them by buying a Johnson cotton bud. No, absolutely no. Why is your little finger little? Only each part of the human body has a specific purpose. Why is the little finger little? To clean your ear canal. And that's only what you should be doing. This small, thin cloth available in Kannada, it is called virus. In Kerala, it's called torth. That's all that you need to use. Wet it, wrap it around the little finger, push it as deep in as your finger will go in. Now, if there is no fingernail, it will go right up to the eardrum and twirl it around. That's the way to clean the ears every single day. Eyes. This has got to last you a lifetime. And if you do it properly, it will last you a lifetime. Now, may I make it very clear vitamin E to a large extent prevents cataracts from forming. I gave that to my father about 84. He absolutely did not have cataract. Our dog, which was totally blind with cataract, I gave them 400 units of vitamin E twice a day. By about 10 days, 2 weeks, it slowly started clearing off. Otherwise, he was almost fully, completely blind. The third thing is there is a way to use your eyes. Quite often I've observed that you will have a blank stare and fully stressed. No, but if your eyes are to be used for pinpointed vision, otherwise you're misusing or not giving. Eyes are also a bunch of muscles. And if you're not having a pinpointed vision, these muscles that govern the pinpoint vision are not getting exercised enough. And eventually your sight will alter. I've seen students, they go read late into the night and directly go to sleep. If you do that, the eyes are fixed for a short distance and later long distance they cannot see, and eventually they'll sort of have short sight and eventually require glasses. No, every single day before going to sleep, you should look at tell your children, you should look at a far object, specifically pinpointed, blink. When you blink, the eye gets reformatted. Six muscles on either side, 12 muscles get reformatted to ensure good vision. And if you do that, throughout your academic career, you will have good vision. I tell many IT people, every 10 minutes of usage, just close your eyes for 2 seconds. That's all that is required. Just close it. You will feel a certain amount of burn. That means you have not been using your eyes properly. Every 10 minutes, just close your eyes, relax, and then continue working. So a few things about the eyes, keep it relaxed and keep the focus pinpointed. When you blink, now look at your own car windshield, how the wipers will clean the windshield. Similarly, the eyelids, each time you blink, the eyelids nicely wash the cornea and keep it nice and fresh and clean. Quite often I've seen students, they almost lose the habit of blinking, and now develop it back. Make sure that you blink quite frequently. And as far as possible, when you're using glasses, I have not seen a single patient wearing glasses by their eye specialist or opticians. Tell them, listen, you need to put the glasses under running water, tap water, apply soap, wash it thoroughly, and then use a clean, dry cotton handkerchief and wipe it. How nice and fresh and bright it is. But quite often when I look into glasses, they're all smudged and filled with oil and dirt, and they would not even have cleaned it even once. So consider, and in between where the bridge of the nose is, where the clip is, there was so much of accumulated dirt there. Once in 6 months, go to an optical, they have what is called the oscillating glasses cleaning machine. They'll completely clean it and give it to you. So that is your part of your life, isn't it? So therefore, make sure that you put the glasses under tap water, apply soap, wash it, and then wipe it with a dry cotton handkerchief, and it'll be so nice. So relax your eyes, have a pinpointed vision. Whatever you see, pinpointed, look at a point, pinpoint vision. Even when you're reading a book, pointedly focus on just one word, not the entire page, and then take care of these glasses and keep it relaxed. Now, if you do that, you will find that the eye power remains constant. If you do not do that, from minus 0.25 to minus 1, 2, 3, 4, and you just simply shoot up. And beyond a point, there are terrible complications that can happen. So take good care of your eyes. And vitamin E, I said, can prevent cataracts. As far as parents are concerned, at least once a week you should take this because it prevents cataracts from forming. Otherwise, what is the absolute guaranteed thing in everybody? Invariably, a cataract will happen. Now, beyond a point, the back part of the eye, which is called the macula, undergoes degeneration. That can be prevented by the skin of raw tomatoes. So once in a while, have some tomato salads because it has this fantastic effect. Now, tomato skin tablets are available called lycopene tablets. You can take that as well. Where is the other rich content that prevents senile macular degeneration? The yellow of eggs. The yellow of eggs, many said they don't touch it because it contains too high a cholesterol, absolute rubbish. Whatever you take, nothing happens. The cholesterol in your blood is manufactured in the liver, and the cholesterol has now been taken out of the dangerous list. So we'll leave that and come back. So take good care of your eyes. Do not touch your eyes with your hands at all. Now, the virus that causes conjunctivitis does not, like the coronavirus, in the air, it does not go. It has to be transported by the touching of the hand. And if you do not touch your eyes Waves of conjunctivitis will come and go, but you and your family will remain untouched. Well, I did tell them to my family and my children. I said, don't touch your eyes at all. Many of their classmates and all that will get conjunctivitis, but we have largely remained uninfected. So take the basic precaution, understand the dynamics of every single infection, and take due care. Hearing, how many people are becoming deaf nowadays? It is so sad, and beyond a point when you're deaf, nobody will ever care for you. You're completely cordoned off from society. People would not want to interact. It is so miserable to wear a hearing aid. What can prevent hearing loss? Please know very clearly. Today we know resveratrol, which is present in the skin of black grapes, absolutely protects hearing. So at least once a week, have a glass of black grape with the skin juice that will protect hearing. And mothers, when too much of calcium the baby takes, the mothers, where does the baby take calcium from? The mother's bones, as well as where the rich calcium is there in the ears. And eventually the mother loses hearing. So sad that is when she sacrifices for the baby, gives the calcium, and she loses hearing. Now, what can prevent it again is fluoride. Make sure always, whenever you buy, I've seen who does the greatest mockery, Colgate toothpaste. It has some of these brands have no fluoride. When you're buying a toothpaste, make sure that there is a fluoride content within, and it is the routine use of fluoride containing toothpaste or fluoridation of water resources that has largely sort of made this disease obsolete. So that's how it is. Take good care and make sure there is fluoride. And the moment you have a slight cold, the ear shuts down. Toynbee's maneuver ensures that the tube is open. How do you do that? Pinch your nose and swallow. When you do that, the tube that connects the ears to the nose opens up and thick secretions will clear off. And lastly, more importantly, if you're in Diwali time, beyond a point, the ear cannot sustain loud sounds. If you're in an audience and you're going for some festivities, you're sitting next to a speaker. I've seen people lose their hearing by intense sounds. 45, even 15, 20 minutes of very loud sounds is enough to finish off your hearing. And if you act heroic and a loud firecracker is about to happen, and you say, oh, it's okay, I can sustain, I've seen people lose their hearing. So if it is too loud or going to be loud, close your ears and protect yourself. Do not sit next to a close high intensity speakers. I've seen people go to very powerful nightclubs, or they wear powerful what is called bass boost headphones, very loud sounds. I've seen medical students use it for 45 minutes and they become deaf for life and you can't get it back. Now, I've seen children use pencils to scratch their ear. Somebody will hit on that hand and this pencil sharp point will puncture and go into the eardrum, puncture it, burst it, and ultimately there'll be a big hole in the eardrum. So take care of that. And of course, neural regenerators are a new concept just coming in. We'll not touch on that. And this pencil, this child, the person who was having scratching his ears with a pinpoint of a pencil, somebody just hit on his hand, the pencil sharp point went inside and ruptured the eardrum. This is the eardrum, ruptured it, and there's a big hole there. Sometimes it will not close, and that will require surgery to close it. Hearing contributes to protecting hearing loss and black grape or in maintaining cognitive health. Now, quite often this becomes quite common nowadays. They have very bad heartburn because the acid goes back into the esophagus and causes a very bad burn. Now, why is it happening? Because the lower valve that prevents this from going up is a little faulty. What is an ideal way to treat it? Number one, raise the head end of the bed by about 10 degrees. This gravity will prevent. Sometimes many illnesses can be treated by just gravity. Gravity will prevent the acid from going up. But if you have very bad heartburn, instead of supporting pharmaceutical companies and taking on drugs which have its own side effects, it is rather better. What did the grandmother say? Use olive oil. It works like magic. 1 teaspoon of olive oil for 3 times a day. Even very bad acidic diseases. What is acidity? Caused by a bacteria, and this bacteria causing this thing was discovered by this fantastic doctor in Australia. And he said because it is caused by by a bacteria, which is called Campylobacter pylori, he developed an antibiotic to get rid of it. So thousands and thousands of lives have been saved by that drug regime called Pilokin from people who suffer very bad acidity. But what did the grandmother say? Many of these grandmother's tales, I wish somebody would compile and keep it online because these are fantastic. This grandmother said you can flush off this bacteria by simply olive oil thrice a day, and it works within seconds. If you have a very bad heartburn, keep a bottle of olive oil next to your bedside. Just take 1 teaspoon. Within few seconds, your heartburn will disappear because it forms a coating and prevents that burn. Now, there is a question: does cell phone cause damage? Now, please know very clearly that cell phone usage has spread widely and the incidence of fatal brain cancer has tripled. Please know that. Now, there is a thing that you can dial on your own phone, *#07#. Immediately, it will show you the amount of radiation in your phone. How much would it be? Not more than 1.6 SARS, specific absorption rate. We'll come to that. Now, what does this study show? That the chance of getting a brain tumor specifically on the side of the head that you use the phone goes up by as much as 40%. I have personally known people who have developed a brain tumor because of continuous and incessant usage of cell phones. Which phone has the highest radiation far beyond what the government permits is iPhone 6. Which has got the least radiation is iPhone 6 Plus. But know about this, duplicate phones will not show the radiation. But again, if you dial *#07#, it will show the amount of radiation from your own phone. There are a lot of talk about 5G, but we'll not touch that now. Do not use a mobile phone while the signal is weak. You are supposed to have 4 bars. If it is only one, then the phone is trying to amplify the signal, emitting a greater amount of radiation. Weakness to make the phone work harder to radiate radio signals to capture the weak signal. Did you know about that? You didn't know. An Israeli research group reported a sharp increase in incidence of parotid gland tumors. There are so many people. The side where you keep the phone, the parotid gland becomes too heated up, the SNI will break, and eventually a tumor will increase. Researchers found a 4-fold increase in parotid gland cancers from 70 to 2006. So, whereas the other salivary glands, which are not in the vicinity of the cell phone usage, have Yeah, we lost you for a second. We are back. I hope my voice and finish here. Now, if you talk for about half an hour's time and if you keep your hand to the side of your neck, you will find that to be burning hot. That side would have heated up like anything. What is being affected? The parotid gland. Quite a number of patients are now coming with parotid gland tumors. So be careful. I hope, like earlier, if you were to put a coin in a coin phone, exactly after 3 minutes, the phone will simply just shut off unless you keep putting further coins. I wish there was an app that says after 3 minutes, the phone will just shut off. Otherwise, the person at the other end will continue to talk endlessly, prohibiting you from closing it down. So do not talk for more than 15 minutes, it is said, per day. You talk for more than 2, 3, 4 hours. Imagine what damage it can be having. Now I leave that there and look at this thing called the danger area of the face. This area from the nose to the side of the lips, within that, if a pimple happens, do not touch with your hand. If you do that, infection, dirty fingers, and bacteria from here will directly go into the eyeball and to the brain. I've seen girls pluck pimples in this area and they have lost vision. For life, they become blind. You see, be very careful. That is, if you put on the internet, Google search dangerous area of the face, you can immediately see these pictures. And that is a do not touch with your hand if there's a pimple. You may simply apply a hot fermentation, sterile, clean cloth, put in hot water, just put it on the face. In about a day or two, it will clear off. But do not pluck a pimple in that space called the dangerous area of the face. You see, this is what can happen. Terrible tragedy. So now look at the ear. Just behind the ear, there is a bone. Now from that bone, the major nerve supply, that's a faulty design. Whoever designed this sort of did not have the idea of a good, look at many of these Japanese cars are so perfectly designed, but there is a nerve coming out of that bone just behind the ear. And if you apply cold there, I've seen student who was traveling on the third berth, the third three-tier AC coach, the third is right up next to the AC vent. Throughout the night, they will travel. They're going for an exam. By morning, their face will be paralyzed. I've seen people travel in the side of the train where the window is open. Throughout the night, they keep it open. Cold air hitting that corner and the face will be paralyzed. So much of tragedy. I've seen people sleep with a table fan. A ceiling fan does not matter, but if there's a table fan continuously hitting the side of your face, then that nerve will undergo paralysis and result in Bell's palsy. Now, this patient has this entire right side of the face paralyzed. Now, so many people have had this thing. So you got to protect yourself in that corner. Now, how will you? That is where the nerve is. How will you protect? Use this thing called a monkey cap. A monkey cap has a thick woolen cover at that corner. You see, this is where the nerve is, and that's where you got to be very careful. That area should be warm. Whenever cold touches, you're sitting next to a window AC, you're next to the bed, and throughout the night, this chill AC is hitting here. By morning, the face can be paralyzed, and once that happens, it can be paralyzed for life. So protect yourself. Do not expose that corner, and make sure that you're well protected. Now, how many young mothers, they lose iron because the baby takes much of the mother's iron away, number one. Number two, monthly loss of blood, menstrual blood will cause iron to be lost. The third that blocks iron absorption is tea. So a combination of factors, if you look at young mothers, many of them will be iron deficient. And usually, ideally, the hemoglobin should be around 13, 14 gram per deciliter. But if it keeps falling down, then what happens? These are young mothers who inspire no habit, still they will develop a throat cancer. Please know very clearly, iron deficiency causes throat cancer. Are we aware about it? Has anybody made a noise about it after 60, 70 years of independence? Is there any focus on these things? How many young mothers come with the throat irritation? When we check inside, there would have been a throat cancer. Leaving, in a short while, they will die, leaving a very sad small children, nobody to take care of them. So therefore, make sure that your iron status is adequate, and do not touch tea. If our iron is low, less than 14 gram per deciliter, take an iron tablet to ensure that not only iron, vitamin C, B12, folate, copper, all of it which are required to make sure that your blood level of iron is adequate. There is a growing importance of sunlight. Number one, it increases immunity, which is why those who work in good sunlight are not touched by corona to an extent. Why? Because it increases T cell immunity. Number two, it dilates, it releases from the skin nitric oxide that dilates the blood vessel, and as a consequence, the blood pressure comes down. Number three, it is now known to reduce blood sugar. So therefore, spend time 10 not walking, 10 minutes, just sit in bright sunlight. Now it's a rainy time, but whenever the sunlight, spend 10 minutes in sunlight, it has an extraordinary effect in protecting and preventing these illnesses, which is why those who work in bright sunlight, you will hardly ever find them having blood pressure or blood sugar. So that is the extraordinary benefit sunlight has, which is why I suppose the ancients designed this thing called a Surya Namaskara in which you have to do a series of exercises, ensuring that you're there in sunlight for at least 10 to 15 minutes time. So it's not the religious part of it, but the very fact that we spend enough time. I saw in a school in China where early we had gone there for a visit, and all the parents would bring their children by about 7 o'clock. They're inside till 9 o'clock. They have a good academic drill. 9 o'clock, the entire school comes out, and in the field they have a good drill, exposing them enough for enough sunlight. Where is sunlight factored into our academic education system? So sad it is. Now we now know. Look at these patients. This patient had a blood sugar of 410. I did not change anything. Drugs, diet, nothing. Just 1 month later, the blood sugar has come down by 100 milligrams just by exposing sunlight. You see, it's a very clear documented evidence of how things change. Now, we also know that vitamin D and diabetes, if you have adequate diabetes, it plays a number of important roles in the body. Now, vitamin D has a bearing on making yourself protected from diabetes too. Do we, as a diabetologist, exposing your skin to the sun for 15 minutes each day can help increase your own body production of vitamin D and thereby reduce your risk of diabetes. You see, many diabetics come to me. We now have a diabetic cure. Any diabetic to a large extent, they can be cured. But part of my treatment is sitting for 10 minutes in bright sunlight whenever sun is there between 7 to 10 in the morning. That's how fantastic it is. Exposure to appropriate amount of sunlight is a basic health requirement that far extend beyond blood pressure normalization, because vitamin D helps systems and organs throughout your body to function. Millions of years humans have lived on earth. This thing of living in concrete jungles, absolutely zero exposure to sunlight, it's only happened in the last few decades. So think good. If you have, I've seen people who are so mean and so think only bad about others. I've seen so many of them develop cancers. What you give out to others, there is, I have no religious or political leaning, but there is a Sanskrit thing called Aham Brahmasmi, which means I am that. The universe is part of you yourself. And if you think bad about others, you're thinking bad about yourself. If you're mean and vicious, if a person mean and vicious to others, you're being that to yourself. And how many patients I've seen with this very bad thought process develop autoimmune diseases, develop cancer, so many I have seen of various things. So therefore, be of absolute positive mentality. And what is the last wish? Recently, they did a survey. What is the last regret of the dying? There are 5 regrets. One of which is, I wish I had chosen to be happy. Quite often, we are so unhappy about so many things, and that internally degenerates our body systems. What is the last wish of the dying? I wish I had chosen to be happy. What are the other wishes of the other regrets of the dying? I wish I had chosen a career dear to myself. I wish I had not worked so hard. I wish I had kept in touch with my friends. I wish I had the desire, I wish I had the ability to express my feelings. Quite often we will think, what does the other person feel? Don't think about it. If somebody is hurting you, express your feelings. Yesterday I was traveling in the train. The fellow in the next coach was talking so loud on his mobile. Beyond 10 minutes, I went up to him and I said, excuse me, you're disturbing me. Please tone down. He said, oh, I never realized, so I'm so sorry. So if somebody is disturbing or hurting you, express your feelings. Pursue a career dear to yourself. Do not, I've seen so many students come into medicine. I asked them, why did you come? No, my parents wanted me to be a doctor. What did you want to be? I had so many other dreams, but my parents said that we should have a doctor. To never force your children into any particular discipline. I wish I had chosen a career dear to me. I wish I had not worked. So we work 30, 40 years very much and accumulate tons of money. Ultimately, when we go empty handed. What did Julius Caesar say? When my dead body is being taken for burial, put 2 holes on either side of the coffin and push my hand out, showing I go with nothing in my hand. That's how it is. I wish I had chosen a career dear to me. I wish I had kept in touch with my friends. At the fag end, students are so focused on getting marks and ranks, and then they fail to keep in touch with their own classmates. Beyond few years, all of what we studied is forgotten. We only wish, oh, I wish I was in touch with my classmates. Now my batch is trying to figure out where our classmates are. But by this time, 30 years down the lane, more than a dozen people have already died and gone. So when you come back again, always think good towards yourself, think good about the others as well. Now look at the brighter side of life. Life has a positivity too. Is everybody who's getting infected with corona dying? It is a few whose immunity is not robust. So therefore, think of the so many things. What is the greatest thing that we have? We have major fears, but quite often these fears never ever come true. So look at the brighter side of life. A 9-year study found that older people who have a more optimistic look on life and the future seem to live longer and healthier. People who had the highest optimism levels were more likely to have survived the slings and arrows of life. I've seen people live in fear. I say, oh my God, if I go outside, I'll get corona. They don't go out of their house, nothing at all. Eventually, they get corona. And I've seen people who have it, don't care. They take the basic precautions of mask and all that, but they have an inner resolute resilience. And to a large extent, they seem to be remaining protective too. So therefore, be of firm, strong mind and think positive to others. When other relevant data was accounted for, they found the risk of death was 29% lower amongst the highly optimistic study participants. So look at the positive side of life, be positive about everything in general, and be of pleasant demeanor and good nature to all. Children, now I said about breastfeeding. If they are fed while lying down, there's a large chance that it will directly go into the ears and cause terrible ear infection. I have hardly seen children being monitored from very young, right up to they are adolescent or until about 18 years. A growth chart must be maintained and specifically plot what is called the growth velocity curve. Quite often we miss this, and then beyond a point, oh my God, my child is so short, and after 18, the bones will fuse and nothing can be done. Today, of course, by surgery, we can lengthen the limb, but that is extraordinarily difficult and expensive. If at a very young age we catch them, then today, please know very clearly, until 18 years, I run a clinic for vertical growth velocity. So many children have come and they have shot up in height. My own children were stunted for a while. I was really wondering whether they require growth hormones or whatever. Then I broke the code and gave them. Today, of course, they are 6 footers. So in about a month's time, they shoot by about 1 centimeter. And however we can make them as tall, do not say because my parents are short, I am also short. No, no, no. If you look at all Americans, they have a good nutritional profile. They are quite tall. So today we know exactly what governs growth rate, and we can make children before 18 as tall as you want to be. And vaccination, of course, there is a lot of confusion whether about vaccines, but the routine general vaccines must be taken because these are viruses which are not mutating. And for example, diphtheria, pertussis, tetanus, the measles, mumps, rubella, and the newer ones, the meningitis as well as the hepatitis B vaccine, based on a pediatrics advice, you must take them because it is terrible if meningitis is not taken and they develop meningitis, then they will become deaf, and finally life becomes one difficult misery. So the correct vaccination schedule as governed by the government must be followed. And this is a tiny little tube that we will insert into the eardrum. I was initially attempting to treat with drugs, but when thick mucus is within the drum, in the middle ear, it can go into the inner ear and cause permanent deafness. So if there is a child who says of late, the mother says it's not attentive enough, the teacher says that the child is not focusing, maybe the child has had a very bad infection and it is fluid is filling the ear, you must quickly go inside, put this tube and pull that fluid out. How many children we have treated and they've all reverted back to normalcy? I've seen too many who have not been treated and they become deaf for life. Now, if the child's immunity is not adequate, if a high fever, they will develop fits. Each fit is causing a scarring in the brain. And once that becomes a little larger, then they will start having fits even without a fever. So if a child had a fits, the moment there is a fever, you must aggressively go inside and bring that fever down and give what is required nutritionally wise so that they don't develop these fevers. Now, tonsils, when there is an infection, these are fleshy masses kept by nature Number one, to continuously guard the aerodigestive tract. And by chance, the patient were to swallow a fish bone, sharp thorn, the tonsils will go pluck it out. And when a child comes with a fish, doctor, they have swallowed a fish thorn, I will often find it poking out of the tonsil. I will just catch it and pull it out. And when the tonsils are large, we simply chop them off. That's a wrong thing. The first study in the world looking at what is it that causes it, it was done by me along with my postgraduate, and we found that those children who had low levels of zinc, they are the ones who are susceptible. All we need to do is just give zinc plus a few other nutrients. These tonsils, how many hundreds of children we have treated, these tonsils will completely shrink and disappear. That's about the tonsils. Now, heart attacks has become an epidemic. Now, losing excess weight, exercising regularly, controlling diabetes, and lowering blood pressure, all of that are important and crucial in preventing heart attacks. Now, let me make it very, very clear. Losing weight is a Herculean task called the yo-yo dieting, strict rigid dieting, extreme exercise. You will lose for a while and then all comes piling back. Today we know, I suppose I will show you pictures later, that slim people are slim because they have a bacteria which has been identified. No exercise, no dieting, no nothing. All that you need to do is just swallow. The entire fat will simply melt and disappear. Controlling diabetes, as I said, just sit in sunlight 10 minutes and you will all revert to a large extent to normalcy. High blood pressure, of course, now we know that the major cause is calcium. Framingham Heart Study, multiple risk factor intervention trial. Have the habit of drinking a glass of milk and 5 minutes of sunlight, your blood pressure tends to go up. I have treated in 9 weeks when it addresses all the calcium requirements of the body, gradually the blood pressure comes down. What do we now do when there's a high increasing it? No, that's not the way. Just sit in sunlight, give calcium. 9 weeks down the lane, they will be cholesterol is no longer a point of concern concerning your diet. However, you must once a year check your LDL, and that should be less than 100. 1 or 2 raw garlic, crush, chew, and eat it because the allyl methyl trisulfide has an effect in lowering it. Number 2 is fish oil. I have treated enough number of patients with fish oil. All this thing comes back to normalcy. Of course, cigarette smoking is something that one needs to be careful about and take control because it's a wonderful machine the human body gifted to you, and then that you cannot be spoiling it by smoking and drinks and drugs, and that's up to the individual. Well, it is recommended that fresh fruits and vegetables. What is the cause of cancer? Breakage of a gene caused by smoking or drinking. Now, this gene breakage to a large extent can be prevented by 5 servings of fresh fruit and vegetables every day. Now, these are people, if you were to doing that to a large extent, they will not develop cancer, even though that does not mean that you can with that. But as far as possible, fresh fruits and vegetables every day, less saturated fats, and one multivitamin. What is the major thing? Folic acid. Today we know folic acid reduces what is called homocysteine. And the more it reduces, the less a chance of getting a heart attack. Or 2, homocysteine is found to be high in those who develop cancers. What can bring it down? Folic acid. You see 400 microgram folic acid in addition to B6. Now, B6 and folic acid reduces the ability of the platelets, which do not clump. One doctor gave B complex containing primarily B6 and folic acid patients around that town for 2 years. In 2 years' time, there has not been a single heart attack. Now, based on this, we're about to start a heart health program for an annual registration fee. Nearly 100% we will guarantee your heart will remain healthy. That's about attacks. Vitamin B6, you see, the core key to preventing heart attacks. Vitamin B6 opens the door to eliminating the 20th century epidemic of heart attacks, cardiac arrest, and strokes. I tell in my class, I tell your own parents, take a B complex every day because so many children, students in the process of study, somewhere along the way, fathers will have a heart attack and die. And once that one, it brings a halt to the entire family. What amount of tragedy and this terrible thing it is. But do the colleges where the students are studying tell parents, please take a B complex every day, because one B complex will protect yourself for 24 to 48 hours. Now, although shunned by researchers who receive the bulk of heart disease research, you talk to any cardiologist, they will laugh it off or be sarcastic. It is creating excitement among a growing number of investigators. Relevant bits of B6 history are presented to show how it can prevent heart attacks. Such a overwhelming discovery. Everybody to decoupling that happen. So cholesterol, of course, it should be less than 100. What is far more important is low density lipoprotein, which should be less than 100. Now, it is terrible to not realize in the golden hour, if a person is having a heart attack, the first thing you should do is not a nitrate or other drugs, aspirin. 99.9% of people who die of a heart attack die so, which in the absence of aspirin. If you were to push an aspirin tablet, it will quickly be absorbed underneath the tongue. You need not really put it under the tongue, just put it in the mouth, it will quickly be absorbed, and 99.9% of deaths can be avoided. Now, leave it there. No, so what does the American College of Cardiology say? Anybody after 45, you must carry a couple of aspirin tablets in your pocket, because that is a thing that can, a heart attack can happen at any point of time. Suddenly it will come, strike and finish a person off. So many people die of heart attacks. We try to do so many things, but this one thing, please remember, can save lives. Now we leave it there and look at so bad varicose veins. The veins become dilated and then blood starts accumulating, and then how bad it is. But please know that that can be strengthened by the skin of fresh lime. Grind a piece of skin of fresh lime, mix it with honey to reduce the bitter taste. Take it every day. I have now treated countless people with very bad varicose veins. All that will rectify. Today, the skin of fresh lime containing an ingredient called procyanoanthidine is now available as a tablet. If you can't do that, then take the tablet like a magic. It works, and it will revert it to wonderful, perfect sculptured legs. So that's about now. A few things you should do to prevent these varicose veins: exercise regularly to improve the strength. Do not cross your legs while sitting, because if you do that, these vessels will get compressed. Do not stand for long period of time. Make sure that you have high fiber fruits. But now we know what is the main ingredient, why the veins are becoming lax, and that can be strengthened by the skin of fresh lime. So lime, that is a key factor. Now slimming, of course, we know that high intensity interval training. What does that mean? There is a specific formula. 220 minus your age into 75% gives you a figure. I repeat, 220 minus your age into 75% gives you a figure. And that is the rate at which you should be exercising to burn fat. When you go on a treadmill, when you hold the handlebar, it will show you a figure of your heart rate. These fellows who are running these things have any idea about these things? Ask them and they have no clue. So that's the only way to burn off fat. Otherwise, the muscle is getting burned and you'll end up becoming more obese. And once you do that, stop it. You need to only do this for 2 minutes. After that, the body cools down for nearly 1 to 2 hours, called the afterburn. Nature has its own slimming ingredient, which is why in nature, you go to a jungle, do you find anybody, any animal obese? You come to the town, you look at dogs which are domesticated, they'll be so fat and obese, they can hardly walk. So therefore, there is something called the slimming bacteria. All that you need to swallow the bacteria and just swallow that. All that fat will be burnt off. So hernia, of course, is because the small little gap. If that gap widens, there is a possibility that the hernia can happen. And in such cases where the wall is weak, you have to perform exercises which we'll talk about later in the episode. Now, flat, then and try to touch your toes. You're strengthening the abdominal wall, and to an extent, hernia can be. Now, this when the connecting ligament in between are weak, then the disc will come out and result in a disc. Excruciating pain very bad as a patient almost become bedridden and surgery eventually was required. Now we know that connecting just just, just by drugs and if my screen or voice is not clear, but constantly it seems to disconnect. If my screen or voice is not clear, these are crucial important knowledge. And if you're saying, then you can sort of put a message in the chat box because I have unmuted everybody. These connecting ligaments can be strengthened, and so many bedridden patients, we have made them recover completely back to normal just by treatment alone. So people between the age of 20 and 50, if you suddenly lift a heavy weight, then sudden connecting ligament can break through. This prolapse can happen and excruciating pain, but do not need to suffer because now we can cure you. Now, Mangalore, where our college is located, is an endemic area for malaria, filaria, and all that. So, what transmits it is mosquitoes. When do they bite? I insist. Now, I must confess, not only we other colleges, we have lost students to brain malaria. So I tell people there are postgraduates so sincere, they work in the hospital day and night, evening they get bitten by mosquito, 2 3 days they become fever, sick and die. How tragic it is for a patient with so much of expectation and desire. They send their children, ultimately a dead body comes back. So therefore, you got to be extremely, extremely careful. What are mosquitoes attracted to? The human sweat smell. I used to tell people, scrub yourself in the evening, scrub completely thoroughly with soap and water. Make sure that there is no sweat smell. Apply a mosquito repellent because one bite and the passport and visa can come. Where few students have died because of malaria. It is so sad and tragic. And therefore, earlier, what is the great thing about Mangalore? Filariasis. The moment we come to Mangalore, we see people with huge elephant legs, and everybody we took a anti-filarial drug for 3 weeks time. Today, we don't see all that anymore. But malaria is still present. We lost. I was with the Manipal group, and in the Manipal hospital, we lost our department typist because of malaria, and we have lost people like that. So be very, very careful. One mosquito, don't think it is a thing to be neglected because these are dangerous things. We have had dengue fever. Suddenly the blood count will go down, and beyond a point, our medical superintendent had terrible dengue, and it was so weak that eventually bleeding started. Of course, we do know that if we timely intervene by increasing the platelet count, what increases the papaya leaves tablets, which will quickly improve and they can be rescued. But there is a dangerous time limit beyond which we cannot rescue. So you got to be very, very careful about these things. Prevent malaria, filaria, and between 5 to 8 p.m., make sure it is during the days. I always sense in my family when children, if they want to go out and play with their friends, they have to sort of spray this anti mosquito odomus or what or moss free it is called, or even a perfume which will mask the human sweat smell, and they will be protected. But so do not drink because we source our water from so many sources outside in hotels and all that. They take tap water. Do not touch it. Only drink bottled sterile water. You might think, oh, I'm spending 10 rupee, 20 rupee. Doesn't matter because you are protecting your own health. And absolute sterile water prevents typhoid, jaundice, and wash with soap was made before Corona, but today it's become all the more important. Every time, make sure just simply applying a sanitizer before food. Now, wash your hands with soap before every food intake. A few things about what contributes to number one, almonds. It lowers blood pressure for elder people. It lowers blood pressure, reduces cholesterol, prevents heart disease, and all that. Almonds. Iron deficiency. Make sure because so much of patients, especially when they come from a mountainous area, we are found to be iron deficient, and they will manifest as large goiters. So make sure that you use only iodized salt. In spite of it, after surgery, patients come back with a enlarged thyroid. What prevents it? Because the iodine that they take in after surgery is not getting absorbed, because like iron, it is getting blocked by tea. And invariably, when I ask them, do you drink tea? The answer is yes. So therefore, I've seen patients take cabbage for 3 days. Somebody comes from the village, gives them cabbage, they eat that for 3 days. Fourth day, the thyroid will enlarge. So make sure that they don't touch cabbage at all. And especially during pregnancy, do not touch it, because the child will not get the required iodine, and then they become dull intellectually, which is why the child whose mother has taken a lot of cabbage, we call a dull person cabbage. So that's how the thyroid can become enlarged. So make sure you take iodized salt, not rock salt, and do not take substances that can block iodine absorption. So therefore, make sure that you're nice and good, and do not spray. Quite often, boys think girls are attracted because they spray a variety of deodorants. But these deodorants, if you spray, it's a fine mist. The powder, talcum powder, is a little larger, but fine mist like the deodorant can go, it can block the sweat glands. Sweat can accumulate inside, and it can result in a large axillary abscess. And once that happens, it can cause terrible reactions too. But once this happens, you simply cannot treat it. You have to go inside, operate, and remove all the pus. And this is a dangerous area where all the nerves are. You've got to be do not, I repeat, do not use deodorants at all. You may use a perfume, but not a deodorant into the axilla. But the marketing guys are so aggressive that they'll make sure that their products will sell. So that's a sad fact of business aspect of it. So therefore, only scrub yourself thoroughly and make sure that you smell nice. A lot of stones are manifesting nowadays. If you do not drink 2 liters of water per day, then the urine can become concentrated. What is the evidence that the urine is getting concentrated? If the urine is yellow, normally it should be almost clearless. It should be maybe with a slight tinge of yellow. But if it is dark yellow, you are not drinking enough water, and therefore, once a kidney stone happens, life is miserable. And the bigger the stone, the higher the money. About half a centimeter, they'll charge 25,000 to either remove it by either sound or crush it and take it. So there are several remedies which can make sure that you drink 2 liters of glasses of water per day. Now today it's become the fancy thing. I had a dry chapati, dry this, and who are laughing their way to the bank? The gallstone surgeons. If you eat only dry, oil is required for the gallbladder to contract. And if you don't have oil at all, the gallbladder will not contract. Bile will accumulate in the gallbladder. Eventually, gallstones can happen. This is the bile gland and gall. So once in a way, have a nice oily food that will cause it to rapidly contract and push all the bile out. Now, if you do not, why did we earlier have some fruits after every meal? Because ascorbate will flush out the saliva. If you put a little amount of lime in your tongue, a lot of saliva will flow and it will prevent. But if you do not do that, stones will form in the salivary duct. And as a consequence, now 3 things: stones in the salivary gland to be prevented by lime, stones in the gallbladder by prevented by oil, stones in the kidney prevented by enough amount of water. Now we leave that prostate cancers have become such an epidemic. How many teachers of ours have died because of prostate cancer? Today we know it can be absolutely protected by the lycopenes in tomato. Take 2 or 3 slices of lycopene. Now cervical cancers in females, ladies, are caused by a virus which can be killed by broccoli. Do we have broccoli as a part of our Indian diet? We don't. So make sure a little amount of broccoli, because it can completely kill these viruses that cause cervical cancers. So therefore, definitely 5 servings of fruit and vegetables. will prevent cancers? It certainly can. And fish, of course, certainly will prevent sudden death. Even though everything is normal, suddenly people can die. And that is called sudden cardiac death. Today, we know it can be prevented by one tablet once a week at least of fish oil, of good oily fish, because it maintains a wiring system. If the wire in your house becomes short circuited, your house will be in darkness. Similarly, in the heart, if the wire undergoes a short circuit, the heart will stop. What can prevent it? Fish oil. Absolutely. It's called sudden cardiac death. This is the wiring system through which electrical impulses go, and this can be maintained nicely. How can the wiring in your house be maintained? Good copper wiring and with good insulation. Similarly, this wire also requires good insulation, and that is obtained from fish oil. So that can be prevented by more recent studies. Studies suggest that omega-3 have definitely an effect. Now, spinach gives you the requisite folate as well as B complex that ensures long, healthy life. Garlic brings to an extent down the cholesterol. Spice, especially curry spice, preventing Alzheimer's, which is why he also protects the fish never develop. I tested this day. So today's diet is should the bad line? Yes. Have you ever checked? We do that in a mass. Fruit and vegetables, dry fruits, all of that are essential. Now, in an emergency in your house, suddenly you have learn what first thing to apply? Honey. Honey. Make sure. The other day, somebody emergency called me and I said, apply honey. There's no honey in the house. So first thing, make sure that you have a small bottle of honey because it's a miracle. What is the first thing to apply when there is bleeding? Sugar. Apply sugar because that is a magic of sugar. It's a terrible bleed. You apply tonic and nothing happens. Apply. If you go to a five-star hotel, you'll have a bathtub. What has happened? So many people have slipped and fallen because we don't have this habit. We stand on the bath, in the bathtub and have a shower. But if there's an oil film, you will slip and fall and hit your head, and so many things can happen. So the first thing is make and place an anti-slip mat. It is the duty of the hotel to give you an anti-slip mat and prevent that from happening because so many tragedies have happened. Look at that. That's an anti-slip mat. So wherever you go, later you stay in fabulous hotels, but make sure that first thing you will do is to put an anti-slip mat. Do not fall into a bathtub and bones. So the moment you come outside, put a thick mat here. Otherwise, your wet legs can slip on this, and again there you can have a fall. Make sure how many people elderly have fallen in bathrooms and had hip broken. That's because we have tons of money and absolute glazed marble maybe in the bathroom and they will fall. The bathroom tiles should be rough like this to protect yourself. Heimlich maneuver is something that we should do and be taught to every parent in the house. Suddenly a child is choking, you can go back and push. So that whatever is choking can be expelled out. Do we teach first aid in any academic environment? Absolutely, we do not do that. Just lives have been saved. And if a person is choking, we can go inside and cut open the neck at the level between the thyroid and the cricoid. That's an emergency procedure which should be taught. There's nothing of danger there. You can save lives. We teach it. We do not do that. Progressive relaxation has a relaxing effect and a curative effect for anxiety, for ulcers, hypertension, insomnia. This is becoming common, especially in Japan, where lifestyle is stressed. You have what is called relaxing chambers, spend some time inside it. People are all locked into the small little cocoons, so relaxed that they come out happy, healthy, and maintain a good, healthy lifestyle. In the house, few things to be done. If there are children, they can poke their finger into a electrical socket. So you must have what is called an MCB, which the an MCB will come to the MCB miniature circuit breaker, which will prevent people from gas leak and an explosion can happen. Make sure that the gas tubes are changed and low-lying grinders. How many children have had their hands crushed when the grinder is at the ground level and something grinding, they put their hand inside and get crushed. So make sure that low-lying grinders are not there. Do you want to enjoy 90% of the cash that you make? 10% give it off for charity. What is charity? Your own kith and kin, neighbors, friends and well-wishers, office colleagues, give it to them. Do not give it to the poor because poor are poor by choice. I've been working 7 days a week for the last years of my life. And if a poor works hard, unless there are social factors that prevent them from doing so, but otherwise, if anybody works hard, you'll have enough money. So therefore, 10% give it off to the charity, and charity begins at home. And a few things about the things that we do: endoscopic sinus surgery, and a few photographs of my area of work are the eardrum, the vocal cord, the swallow mechanism, plastic surgery that we do. This lady felt that her nose was like this and got done. If the like this, we can sort of rectify and put it back on this. And we can do all that. If the chin is too much protrude, we can protrude and bring it out like that. And this grandma, new boyfriend, she won't become a little younger. We can do a facelift and bring her back her youth. And some we can take, especially we can rectify and push that back, rectify and make it slim. Of course, there's only one textbook in the world, and that is called e-medicine, in which two chapters. This is accredited by the American board. Foreign doctors amount paid in dollars. That's about mastoid. This is about the plastic surgery for the nose. Of course, two medals I got an outstanding research, and of course, after when we get something, give back to society. I've given back in the my gold medal for in the South Zone for innovations in ENT. There are several things that over the period of years we have discovered on cures for low backache, migraine, vertigo, voice, milia, tonsils. I don't know why it is getting disconnected. I'm so sorry. But these are things that does not exist in the world. Students, I tell them, by the time you're 45, you must be world class and have the best treatment in the world, and the world should come to you. That is how I get patients from all over the Gulf, from Canada, from Australia, from Germany, from Switzerland, from USA. yours that does not be treated. My professor said, cure rarely, comfort often, console always. Today, I say the large part of it cannot, when we cannot do that. So, hair loss, of course, is a new development. Any hair, we can bring it back. Anybody who's obese, we can sort of get their slim. Ah, ah. And of course, I have a clinic in Mangalore. For those of you who are on, after many patients, people have to this my but now of course I far possible we don't see. It's only through WhatsApp consultations that we meet and treat people. That's my WhatsApp number. But of course, the management would expect you to put a detailed feedback on my WhatsApp page 92433012113 on your presentation. Has it been useful? Could it be modified? And express your gratitude to the management because under their direction that all these things are happening. No other college in India, I'm not aware of anybody organizing any program for parents. And this concept has come in, and we hope to be doing this on a regular basis. Earlier, of course, I had an online clinic that was ahead of its time. Today, of course, everything is online. And may the great gods bless you, protect you, and see your children come up in life and achieve flying colors and be a testament to the excellence of the college and to the support that you have given. And may they be walking embodiments of good health, good blessings, and a contributor to society and to the academics at large. Thank you very much. I hope this has been a useful presentation. You have the liberty to unmute. I have relieved that button. Unmute your mic if you want to ask a question. Or of course, you can put a message in the chat box, but I would expect from each one of you a detailed feedback on this presentation. If you so desire, you can mute your mic to ask me a question. This is knowledge far ahead of its time. You will not get this from any source. Tons and tons of effort have been taken to compile all this. And wherever this has been given, patients have felt that a window to their minds have been opened. Yeah, I do know. I do not know why this breaking has happened, but quite often the presentation did get broken. But I was fortunately able to sort of. Is it because the signal where I am is weak, or is it of some other software concern? I have no idea really. But for those of you who are interested, I suppose it has been recorded somewhere, and I will forward that recording. But to a large extent, I try to avoid that because I would expect people to log in, come in, and take advantage of these presentations. You can unmute your mic and ask me anything you want to clarify, because these preventive strategies are something which are not taught in medical schools, and no doctors I find will ever tell you these things. Thank you for your few comments. And there must be, of course, why should we do all this? There must be an enthusiasm, there must be a desire, there must be a passion. And when we do it for parents, then they should all log in and come and interact. Only then we feel all it's just worthwhile. If you do not take advantage of these things and imagine something happens and the heart attack or a cancer happens, by strictly following these things, the large part of illnesses can be prevented. I hope because many people have taken advantage of these things, and as the years unfold, to a large extent, they have remained healthy, protected, and safe. Looking forward to your feedbacks. I shall now close. Thank you very much for your kind hearing. Wish you all the very best. Good luck. God bless.